Welcome back to 50 Days to Rebuild, the series where I do 50 minutes of exercise and read 50 pages of a physio book in a day in an attempt to rehab myself. This is day 27. Before I jump into the exercise portion of things, I do just want to apologize. I don't have the footage of the exercises I did. I was camping. I thought I would have time to sort of re-show what the movements looked like when I got home. I really did not. So this will be the one episode without that, but I will just have a chat about what I did. So looking at that side of things, so I did all of the joint movements from yesterday that Pavel Sassolin recommends. Just generally, I found that these were all pretty chill. Like, nothing felt particularly bad. The sort of telescopic arm one can feel a little dodgy. It's hard to get it to feel right. Like, kind of feels like it gets a little cracky, but if I can almost keep my shoulder down, I'm not sure exactly what it is. I think it's shoulder down. It feels okay, and again, it feels like the joints feel better after those movements. Jumping to the bird dog, I did have to regress this, unfortunately, just because I have been seeing a lot of hyperextension in my back when I've re-watched the recordings. Basically, I just used my friend's car, like his bull bar, when I was out camping, just so I had something to sort of hinge towards and do the bird dog. And I tried to separate this as well, like I was just doing arms or I was just doing legs. Overall, I felt like this actually felt pretty good, and I didn't really feel like my back felt too hyperextended. Again, I didn't get to record this, so I don't know for sure, but it felt pretty good, I thought. I will say I'm actually quite grateful for having gone camping because it actually caused a lot of pain, which I know sounds a bit crazy, but to some extent I do get to a point where pain is information, and if I can actually see what the information is saying, like, I'm kind of grateful for that. In this case, when I went camping and when I've gone camping in the past, I often get a lot of pain from sitting for so long. What I noticed when I tried to lay down the night prior was that I felt like my hips and my back felt so sensitive, which is strange. Like, I used to get a lot of pain laying down, but really not too much anymore. Like, that's actually more of my relief point. So getting pain there is sort of the opposite of what I anticipate. And my guess here was that it was my psoas, just based on where I felt it, the type of pain I was experiencing. So sort of ran with that, did a McGill, like, sort of inspired PNF psoas stretch. So he sort of like laterally flexes and rotates away from the hip during, it's sort of like a lunge. But then I tried to modify it with PNF to actually have some contract and relax. This wasn't perfect, but I did notice some improvements in range and just general feeling. And then I walked afterwards and it felt a lot better. I will add, I went to go walk prior to that and couldn't. This isn't something that's happened for a long time. I used to have to exercise before I could even walk. Even though that's not the order of operations you're meant to run through for spine movement and like health, but I just couldn't walk prior. So that's been a long time since I've had that happen, but I was very happy to be able to walk without pain, basically without as much pain, and I felt the pain reduce as I was walking. I think that the psoas stretch basically enabled enough extension that I wasn't like constantly impinging my hip. Moving on to the hip bridge, similar to the progression I've been seeing. First set didn't quite have it, like the hamstring activation was there, but second set hamstring activation was pretty well off. So again, happy with how that's tracking. Also, looking at the side plank, I will say I think I just have to be careful not to let the butt squeeze that I was able to feel yesterday, that like bilateral squeeze, to sort of throw off my pelvic position. I don't think it has to, but I just noticed that at some points it was, and I had to like really put some focus back into that. So it's something to be conscious of moving forward. And lastly is looking at the dislocates. Again, this mainly felt good, but I will say, like, I'm just sort of unsure if you should rib flare. Pavel said you should, but I tend to rib flare in a lot of movements. I don't know if I should actually be, I guess, reinforcing that movement. I would argue probably not, but there's certain movements, perhaps like dislocates, that actually just require essentially excessive extension through the thoracic spine. So I'm not too sure. I'm gonna have to do some digging on that. Looking at what I learned today, so like I said yesterday, I abandoned the book that I'd been reading because it was so boring. So now I'm on the Science and Practice of Strength Training by Zatsiorsky. This is a strength training book, so I guess to some extent this is a bit of a detour from like a physio book per se, but I am hopeful that some of the concepts around strength training will be applicable or might sort of offer some insight into some rehab ideas. Jumping straight into sort of the heart of their argument around what strength training is that there's this need to beat accommodation, so that's the body adapting, whilst also balancing that we need to do specific types of movements, especially for certain sports. So like, for example, if, like I imagine if you're climbing, you'd want to do lots of pull-ups, but if you do lots of pull-ups, your body's going to adapt to it. So you kind of need to change a lot of different factors, be it like slightly different pull-up, like maybe just do chin-ups, maybe doing lat pull-downs, or like maybe we're changing like the load characteristics. Seems to be like their sort of main argument here that they're making. They discussed max force generation, and I found this quite intriguing. Basically saying that if you want max force, you can't have something that's very light. Like if you were doing like a shot put, you wouldn't be able to generate max force with like the lightest shot put. You'd actually need something decently heavy. And I guess under that is sort of saying that if we're doing anything fast, it can't really be max force generation, because to be fast, it can't be like the heaviest thing that we can possibly lift. Like you wouldn't do like a super quick deadlift as your max lift. Okay, probably the most interesting thing covered was that the time available for max force generation is about 0.3 to 0.4 seconds, but most athletic endeavors require less than that, right? So we're sort of bottlenecked by that. Like that will always be below our max potential. So basically we need to work on getting a faster activation, because that's the bottleneck. That's the thing that could potentially generate more force by getting more fibers involved. One of the ways that they said to do this was to do quick release. So sort of like an isometric hold and then to sort of trigger release all of a sudden. Again, it's sort of that idea of just train what you want to improve, right? So if you want to be quick, train being quick. On this idea of train what you want to improve at, they were saying that if you do specific sort of, plyometric, quick activity, what's essentially happening is your Golgi tendon reflex normally inhibits muscle movement, but if you train it, you can sort of inhibit that reflex so that you get faster activation. Then they called that, like generally speaking, like reversible muscle training, which was essentially like plyometrics. Surprisingly, they discussed eccentric activation, and it was very counter to what I thought it would be. They were pretty like opposed to it. And by eccentric, they mean like more of like a slow lowering, not like a plyometric, even though that might actually be a better definition. And they're talking about how it doesn't get as many fibers involved, but in that initial sort of increase in tension as it's lowering, that's more than it would be in concentric. So we got more tension with fewer fibers, so there's like a higher risk of injury, which, yeah, I was very surprised by. I know I said the most interesting thing was something else before, but I think I was also wrong. Probably actually the real most interesting thing was clarification, finally, around muscle action. So I've studied and memorized a lot of like muscular anatomy, and one of the things that I find really confusing is the action or function, because they seem contradictory and it's very unclear if they're happening simultaneously. And this said, yes, they are. Right, so if you have the bicep, which can supinate and flex the elbow, the question to me is always like, well, is both happening? But it doesn't look like it. Like I can do it without supinating, and that's true. But yes, the force is trying to supinate as you flex the elbow, but now the other pronators will fight it. There's like some sort of symbiotic relationship between the muscles, or synergists, I think is what they would call it. Right, so it synergizes to prevent the unwanted movement. So the example they gave with the bicep was, say I was trying to supinate, that's going to develop or generate an elbow flexion torque, and the tricep will fight that, right? And that's how we get the lack of elbow flexion, which is really interesting because I feel like a lot of movements, you feel muscles activate that like canonically aren't meant to be active. It's like, no, this isn't training that muscle. It's like, yes, but its synergist or its counter, whatever its proper name is firing. It has to. So yeah, I thought that was really cool. And yeah, that is about it for day 27. Again, apologies that there wasn't any exercise footage. That will be coming in the next episodes. But yeah, thanks again for listening, and I'll catch you in the next one. Cheers.